Do your patients ever report overeating at night and then not remembering it the next day? Or does this ever happen to you? Today, we are talking about sleep-related eating disorder. If you're interested in sleep and mental health, then go ahead and subscribe to my channel so you can keep on learning. I'm Dr. Nishi Bhopal. I'm a physician specializing in integrative psychiatry and sleep medicine. Every video contains tips for healthcare practitioners on how to help your patients sleep better, and every video is also eligible for CME. A quick note for physicians, before we jump in, I'd like to invite you to get my free sleep mini course for outpatient doctors. It's jam-packed, filled with high-yield tips that you can use in your clinical practice, and it's also eligible for free CME. You can grab the course at intrabalance.com/doctors. The link is also in the video description underneath this video. This video is number 4 in our 4-part series on parasomnias. If you haven't already seen the first 3, you can go ahead and check those out after this video. Today we're talking about sleep-related eating disorder. Now this is actually a variant of sleepwalking. People who have this disorder sleepwalk and eat and then they don't remember it afterwards. And it happens because of a mix of wakefulness intruding with non-REM sleep. People who experience sleep-related eating disorder usually experience episodes at least several times a week, sometimes even every night, and sometimes even multiple times in one night. These episodes can also happen at any point during the night. Sleep-related eating disorder is not to be confused with night eating syndrome. These are two separate disorders. So some of the key features that differentiate sleep-related eating disorder are rapidly binging on substances that may not actually be food or that may actually be toxic. Some of these substances might be highly processed caloric foods, or they may be raw foods like raw hamburger. They may be frozen, uncooked foods that people are binging on. Sometimes people might binge on cat food, or even inedible substances like cleaning liquids. I had one patient actually who experienced this, and he would get up and eat candle wax at night. The next key differentiating feature is that people have no recollection of doing this, whereas with night eating syndrome, people do remember doing it, and they're aware of it while it's happening. With sleep-related eating disorder, they're not aware that it's happening, and they don't remember it afterwards. As I mentioned, it can happen pretty frequently, even up to every night and multiple times in one night, potentially. It also can cause insomnia because of the sleep disruption of sleepwalking and doing these complex behaviors. When people wake up in the morning, they typically have no appetite. People who experience sleep-related eating disorder and diet or restrict their calories during the day are more likely to have episodes at night because they're hungry and then they're less able to control what they're eating during these mixed states of consciousness at night. Now, who's more susceptible to this condition? So it's estimated that somewhere between 1 to 5% of the general population experiences sleep-related eating disorder. It's much more common in women than men, and it's reported that about 65 to 80% of people with this condition are women. It typically starts when people are in their 20s, and it tends to be an ongoing chronic long-term condition. There are certain causes of sleep-related eating disorder to look out for. The first category of causes is other sleep disorders. As I mentioned, this is a variant of sleepwalking, so you want to look out for that in patients who are experiencing sleep-related eating disorder. You also want to rule out other sleep conditions like obstructive sleep apnea, narcolepsy, periodic limb movement disorder, or restless leg syndrome. The reason being that all of these conditions can cause sleep disruption, which makes people more susceptible to experiencing sleepwalking and sleep-related eating. The second cause to look out for are other medical conditions, particularly autoimmune hepatitis and encephalitis. The third main cause, though, is lifestyle factors. Sleep deprivation puts people at a higher risk of experiencing this, along with irregular sleep schedules. So shift work or jet lag can make people particularly prone to experiencing sleep-related eating. Other lifestyle factors like physical stress and emotional stress can put people at higher risk. Now, the fourth big cause to look out for are psychotropic medications, particularly the non-benzodiazepine sedative hypnotics like Ambien or Zolpidem or medications in that class. These are known to cause parasomnias, including sleep-related eating disorder. Other psychotropic medications that may be causative include antipsychotics, lithium, anticholinergic medications. Medication withdrawal can also be a causative factor, including withdrawal from other substances like alcohol and even cigarettes. If information like this is helpful for you, go ahead and click the like button. As you can imagine, there are lots of complications that can happen from sleep-related eating disorder. One of the complications can be weight gain, leading to metabolic issues like high cholesterol, high blood pressure, diabetes, even an increased risk of sleep apnea, which then can feed into exacerbated symptoms of sleep-related eating disorder. There's also the risk of people eating things that are toxic, things that are not edible, like those cleaning products or candles that I talked about before, or people may actually eat foods that they're allergic to. Now, people are also susceptible to injuries because remember, this is a complex behavior that is happening during sleep. People are getting up, they're sleepwalking, they're walking around their house, they're eating things, they might be in the kitchen using knives, turning on the stove, or starting fires, and so this can actually be quite dangerous because the person is completely unaware of what they're doing, so they're at risk of potentially cutting themselves or burning themselves or even causing a fire in their home. Another complication is mental health issues. People often experience a great deal of shame about these behaviors, and this may lead to feelings of depression. What you'll see on a polysomnogram or an in-lab sleep study is arousals during different stages of sleep. So you might see some confusional arousals coming out of slow wave sleep, which is stage 3 sleep, but you might also see arousals during other stages of non-REM sleep and even REM sleep. Sleep studies might also pick up periodic limb movements or obstructive sleep apnea that could be exacerbating the symptoms. How do you treat this condition? Well, step 1 is prevention. You want to avoid sleep deprivation. You want to make sure the person's sleep schedule is regular because remember, irregularity, shift work, jet lag, just even different sleep schedules on weekends and weekdays can make people more prone to experiencing sleep-related eating. You want to avoid alcohol and those medications that I mentioned that could contribute to these symptoms, particularly those non-benzodiazepine hypnotics like Ambien or Zolpidem. Another aspect of treatment is safety. If there are certain things that the person tends to go to at night that they tend to eat, you can keep those secured and out of the way so the person isn't able to access them during these episodes. Sometimes putting a lock on the kitchen door or cabinetry or the fridge is necessary. Creating a safe environment is important as well in terms of moving out furniture or other objects that could be a falling or a tripping hazard, and then even securing knives or other sharp objects is important. And then of course you want to treat the underlying cause, including things like restless leg syndrome or periodic limb movement disorder or obstructive sleep apnea or narcolepsy or what have you. Also consider changing or stopping medications that could be exacerbating these conditions, like those sleeping pills, those non-benzodiazepine hypnotics, or assess the person's other medications, including antipsychotics and anticholinergics that could be contributing. Now here's a specific tip for healthcare practitioners regarding pharmacotherapy. The good news is that pharmacotherapy is rarely necessary because you can focus on those underlying causative factors like addressing other sleep disorders or medical conditions, or looking at medications that might be exacerbating the symptoms, and focusing on lifestyle factors like the sleep hygiene, regular sleep schedules, and so forth. But if pharmacotherapy is warranted, SSRIs are considered first line, and then medications like topiramate or clonazepam may be considered. Let me know in the comments what was your biggest takeaway from this video.